Now, after assessing the patient, introducing yourself, and asking all of the needed questions, we are going to explain the procedure. So first, we're going to perform hand hygiene. Next is we're going to provide privacy. Again, since we are in an open environment, this is not an ideal situation. So, in a room, in the patient's room, we need to provide the patient some privacy. Next, uh, we're going to let the patient change to his gown. But since, bear with me, since no gown is available, I'm just going to use my old uniform. Okay? So first, we're going to check the posterior thorax. First, we're going to inspect the shape and configuration of the chest wall. Okay. Then, we're going to check the position of the scapula. This is the scapula. We're going to assess if it is evenly distributed. Stay down because the chair is very small. Next is we're going to make the patient sit up, and hands on your lap. In your lap. In your lap. Okay. Then we're going to make the patient inhale and exhale. Ginawa o buhit. Again. Okay. Next is we're going to palpate the tenderness and sensations. So we're going to test if there is skin damages or skin edemas or lesions. So use the 3 fingers and scan. There's some lesions, but I don't think, no, that's it's a mole. Yeah, that's mole. That's skin moles. There are some lesions, but not, I don't think, I think this is a lesion. Maybe not. I may be wrong. If you are unsure of your answer, then consult your physician. Next is we're going to feel around the skin. Does this hurt, sir? No. No. Does this hurt?
No, it doesn't.
No. This.
No, it doesn't.
Okay. Here. Here.
No.
The patient doesn't feel pain. So far, I have not found any abnormalities, or there are no tenderness or pain. Okay, next is we're going to assess the temperature. You're using the dorsal side of the hand. Okay, so now. Okay, so his skin is warm but not hot and not cold, meaning it is normal. It's fine. Next is we're going to assess if the scapula is symmetrical to his shoulders. So please stand up, sit up straight. Okay. There are no differences. Okay. Next is, so far there are no deformations as I can see. The shoulder is an accessory. You can see if it's an accessory muscle, so please breathe, sir. If the shoulder rise up, meaning it is an accessory of the lungs, accessory muscle of the lungs. Okay, and the temperature is normal. We have noted that. The client has no pain or tenderness, and the skin has no lesions. Next is to observe the chest expansions. So put thumbs in P9 and P10. 69 and P10. So let the patient breathe in and out. Oh. Again, notice the expansion of your thumbs. Okay, no problems there. Next, we're going to assess the intercostal spaces of the patient. So we're going to percuss. We're going to put it in the intercostal spaces, second intercostal spaces. So listen for any resonant sound. If it's not resonant or quiet or like a strong drum, then there is a problem. That's resonant. Okay. Last. Next next is diaphragmatic exertion. Use a ruler and marker. Place your hands in the patient's back and let him inhale and exhale. Use the ruler. So please, sir. Centimeter is breathe in and out. Mark. Again. In and out. Okay. Next is the oscillation of breath sounds. In this procedure, we are going to use a stethoscope. So we're going to scan for any off sounds. So let the patient breathe in and breathe out. So, sir. Okay, there are no unusual sounds. Next, we are going to perform bronchoscopy. So we're going to put our stethoscope in the scapula of the patient. Say 99. Say 99. Okay. Last one is the whisper. You have to whisper, sir. 1, 2, 3. Whisper, ha? Hong hong. Yeah. Go. So if it is, if it sounds like muffled sounds, if there's muffled sounds, then there is the lungs or the thorax is normal. Then if it is clear, both tests, I mean both tests, bronchophony and the whisper test, if the sounds are muffled, means to say it is normal. But if it's clear, you can hear the words they are saying, then there is a problem. So overall, I have assessed all the necessary things and found nothing abnormal except for the skin imperfections here, but nothing too bad, no edemas, no problems. Everything is fine, and I think that concludes our video today. Thank you for watching, and goodbye.